Morning, everyone. Can you hear me okay? Is this a decent mic? Okay. Well, good morning, and thank you for joining us today. I'm Lee Jackson, and I am a Senior Program Officer here at the National Academies of Sciences, Engineering, and Medicine on the Board of Health Sciences Policy. On behalf of the National Academies, I welcome you to the second public information gathering session for the Committee on the Clinical Utility of Treating Patients with Compounded Bioidentical Hormone Replacement Therapy. The Academies has convened an esteemed committee of experts to undertake this important research study. And over the next year, they will examine the clinical utility of treating patients with compounded BHRT products, an effort that will include looking at issues related to use, safety, and effectiveness of these products. The committee's charge is described in more detail in the statement of tasks that's been handed out, as well as posted online on our Academy's website. I would like to take this opportunity to thank Dr. Jerry Strauss for his work in helping to launch the NASEM study, and to thank our current chair, Dr. Donald Mattison, and vice chair, Dr. Ruth Parker, for their efforts in leading the committee through the remainder of this study process. I think we're all in store for a day of exciting and hopefully thought-provoking conversations about these issues. So thank you again for joining us in person as well as online. And with that, I'll turn things over to Dr. Mattison.
Thanks, Lee.
You're welcome.
On behalf of the committee, I'd like to welcome everyone to this discussion day. As the chair of the committee and on behalf of the other members, I'd also like to thank the study's sponsor, the Food and Drug Administration, for their support of this important study. I'd like to thank the guest speakers and those of you who are attending today for their support of this individual activity and joining us for in-person and online discussions. We look forward to, I think, a lively set of presentations and discussions. With that, I'd like to turn things over to Dr. Parker, who will introduce our first speaker.
Thank you, Don, and good morning, everyone. So let me begin by giving you a brief overview of our meeting's format. We're going to have 3 panels of speakers who've been asked to share evidence and their expert opinions on topics related to clinical utility, use, safety, and effectiveness of compounded bioidentical hormone replacement therapy products. The topics will include, first, an overview of factors leading to increased use, and I'm going to abbreviate it, cBHRT, acronyms that drive us all crazy, but saying it all might drive us crazier. But that when you hear me say that, that's what it refers to. To the compounded products, the potential safety concerns, current regulatory framework related to the production of these products. Then we'll have a panel that focuses on consumer and provider perspectives on the clinical use of compounded BHRT products, including education and health information materials that are provided to consumers and how medical decisions are made related to product selection. And finally, a panel that focuses on compounding communities' perspectives on formulation practices, safety, and quality control procedures. After each panel, there'll be a short question and answer period for committee, and we've designated time on the agenda for public comment as well. I'd like to remind everyone that this is an open, on-the-record session. However, this is not a news conference, and we will not be able to field questions, all the questions that come from the public or the press. If individuals on our webcast have a question for the committee or the invited speakers, we ask that you send your questions to the study's email address, bhrt@nas.edu. That's bhrt@nas.edu. And we'll do our best to address as many of the questions as our limited time will allow. If there are any reporters present who'd like to speak with members of the committee, we kindly ask that you speak with the senior staff during the breaks. I'd also like to remind everyone that this is an information gathering session. That is, the committee's in the process of assembling materials that we will examine and discuss in the course of making findings, conclusions, and recommendation. Therefore, I ask that everyone here today be extremely mindful of the fact that the committee has made no conclusions to date. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or of the academies. In addition, committee members typically ask probing questions in these information gathering sessions, which may not be indicative of their personal views. The committee will deliberate thoroughly before writing its draft report. Moreover, once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee, and the committee must then respond to this review with appropriate revisions that adequately satisfy the Academy's report review committee and the National Academy of Sciences president before it is considered an official Academy's report. And with that, I'd like to turn things over to a committee member, Dr. Susan Ellenberg, who will introduce the first speakers in the initial panel. Thank you, Susan.
Thank you. Thank you, Ruth. So this first panel is intended to provide overview, context, and background. And our first speaker is Dr. Cynthia Stunkel. Did I pronounce that correctly? From the University of California, San Diego, who is going to briefly describe the results of the famous Women's Health Initiative and discuss the emergence of these compounded products.